Hi, and welcome back. My name is Stephanie Silvera. I am a professor of public health at Montclair State University. I'm also a member of this workshop's planning committee. During the next session, we will be hearing from the two speakers, followed by a facilitated discussion and audience Q&A. Please type your questions into the chat box, including the speaker to whom it's directed, and we will share them with the speakers during the Q&A portion near the end of the session. Full bios for all of our speakers are available today and are included in the meeting materials on the website for this event. But as we get started, I'd like to share my thoughts to open the session. I want to start by acknowledging that when we're talking about innovative policy solutions, we need to first be in agreement on what we're talking about in terms of what is policy. And so we're going to be talking both about large P policy, which are those broad federal, state, and local policies and laws that may focus specifically on health, such as universal access to healthcare, but may also not be specifically about health, but which influence health outcomes. And these include several things that have been in the news lately, like voting rights or housing and education. And often these big P policies influence smaller P policies, which are those organizational policies and practices such as workplace and school food systems. And those small P policies, in turn, can influence those larger P policies through funding availability, enforcement, attention, and equitable application of policies or not. And with respect to equity, when we think about the policy cycle and policy development, we need to consider who the policy actors are. Who are the individuals and populations that have a seat at the table when we're even considering what the problem is, how it's defined, and what the agenda for solving those issues should be, and who isn't at the decision-making table. When some populations are outside of that circle of power, whether we're talking about communities of color, limited resource populations, or in the case of the topic we're discussing today, individuals with obesity, that's going to influence, as we heard earlier today, the language we use in our communication, what data are collected, what data are valued, and our interpretation of that data in our policy development. And when historically disenfranchised populations are left out of the policy cycle, their voices are not only left out of policy development, but they're left out of the policy assessment efforts. And as a result, their perspectives on the impacts of policies, both positive and sometimes inadvertently negative, are also left out of the broader conversation. And so as we move into the next session and our two speakers, I'd like to end with a quote by Mickey Kendall. Right? We have to be willing to embrace the full autonomy of people who are less privileged and understand that equity means making access to opportunity easier, not deciding which opportunities those individuals deserve.